Hi, this is Dr. Poole, and this is a presentation to introduce you to the terminology of neoplasia and cancer. So let's start off with the basic terms. Neoplasia refers to the process of new growth, which leads to the formation of a mass. So a neoplasm refers to a new growth forming a mass. You'll hear the term tumor. This is generically referring to a swelling or mass. And if you go back in time to that blissful period when you were starting your medical school education, remember learning about inflammation. And this term tumor was originally described, if you recall, in regards to the cardinal signs of inflammation, that is, swelling caused by an inflammatory process. This reference has almost all been discarded, and the term is now used in equivalence with neoplasm. As it turns out, the definition of neoplasia is somewhat difficult to get your arms around, as you'll discover in these introductory lectures. But the best definition is from the British oncologist Willis, who referred to neoplasia as an abnormal mass of tissue, the growth of which exceeds and is uncoordinated with that of the surrounding normal tissues, and persists in the same excessive manner after removal of the stimulus which provoked the change. Now, if you dig into this definition on your own, there's several elements of it that distinguish it from physiologic or other forms of pathologic growth. So first is the formation of a mass, and the fact that the growth is uncoordinated with surrounding tissues, as opposed to growth such as from granulation tissue in tissue repair, or the growth that one sees during fetal development. And the fact that it persists, that is, it keeps growing after removal of a stimulus that provoked the growth in the first place. So in other words, the growth becomes independent. So we can also add now a genetic or molecular corollary to this, in that there are causative mutations in neoplasia that give the tumor a survival and growth advantage compared to normal cells, and this results in the excessive and unregulated proliferation that becomes independent of normal physiologic growth signals. Neoplasms have two distinct components. First is what we call the parenchyma, which refers to the proliferating neoplastic cells. And it's the parenchymal part of the neoplasm that determines how we name it or classify it, and the characteristics of these cells as it relates to its biologic behavior. The other component is the stromal component, and by this we mean connective tissue, vascular, or immune cell elements that also form the mass. These elements, however, are reactive rather than neoplastic, and they develop or form in response to and in conjunction with the growth of the neoplastic parenchyma. It's the stroma that also helps determine the neoplasm's growth in natural history, and the interaction between proliferating neoplastic cells and the stroma has a critical impact on the nature of the tumor to remain localized or to metastasize to distant sites. Part of the stroma also includes collagen, and when there's an abundant collagenous stroma, it's the same features as one sees in fibrosis or scarring. And we call this with respect to tumor stroma, desmoplasia. And what this leads to is a neoplasm that is characteristically hard, or you might hear the term scirrhous, meaning scar-like. In contrast, there are tumors that have scant stroma, and these tend to be soft and fleshy tumors because they lack a lot of collagen. The most fundamental nomenclature of neoplasms are benign and malignant. And it's important to recognize that the biological behavior of the tumor that we designate as benign or malignant is predicted from its gross and microscopic pathologic appearance. So chalk one up for pathologists. A tumor can be classified as benign when its growth features appear localized and well demarcated from surrounding normal tissue, and its microscopic features do not dramatically differ from comparable normal tissue and cells. In another presentation, when we talk about some of the general characteristics of benign and malignant neoplasms, we'll go into more depth as to some of these specific features. Generally, patients with benign tumors survive their tumors, even without any therapy. However, you must keep in mind that so-called benign tumors may still cause significant morbidity and may even be fatal to the patient when they occur in anatomically at-risk areas, such as if they occur, for example, in the heart or in the brain. And even benign tumors may exert local mass effects that may cause bleeding and lead to anemia. In general, we name these tumors by attaching the suffix "oma" to the name of the cell type of the neoplasm's parenchyma. Benign tumors of mesenchymal cells generally follow this rule, so we have, for example, lipomas derived from lipo or fatty cells. The nomenclature of benign tumors of epithelial cells, that is derived from ectoderm, mesoderm, or endoderm, is a little more complex. Some of these tumors are classified on the basis of their cell origin, while others are classified according to their macroscopic architecture. So here's a couple examples of benign tumors derived of mesenchymal cells. Leiomyoma, leiomyo referring to smooth muscle derived, and we attach the suffix "oma" to designate a benign tumor. Hemangioma is another example, hemangio referring to blood vessel derived, and again we attach the benign suffix. The nomenclature of benign epithelial tumors, as I mentioned, is a little bit more complex. We use the term adenoma to refer to benign epithelial cells or tumors derived from glandular tissues. Polyp is a generic term that may refer to either a non-neoplastic reactive type growth or a neoplasm which may be benign or malignant. But what they have in common is that they grow as a visible projection above a mucosal or epithelial surface. Cystadenoma refers to benign epithelial tumors that grow predominantly as cystic masses. And we'll revisit this and see this when we talk about ovarian neoplasms in the upcoming Introduction to Oncology course. And finally, papillomas are one of these examples of a tumor that's named according to its architectural appearance. These are benign epithelial tumors that grow as finger-like or warty projections. When we talk about the nomenclature of malignant tumors, we're talking about cancer. And I think everyone has an idea what cancer is. And we use this interchangeably with malignant tumors or neoplasms. A tumor is classified as malignant when the characteristic growth features show evidence of invasion or destruction of surrounding normal tissues, or the neoplasm shows evidence of spread, that is, metastasis to distant sites. Generally speaking, malignant tumors represent a threat to patient survival and shortened lifespan. However, it's important to recognize that there's a wide spectrum of so-called malignant behavior, reflecting the natural history of the neoplasm, as well as the fact that early detection and treatment may change the natural history of the tumor's behavior and lead to long-term remission or survival. Diving deeper into the nomenclature of malignant tumors, we have the term sarcoma, which refers to a malignant tumor arising from mesenchymal cells. And we usually modify this term by referring to the cell type of origin. So we have leiomyosarcoma, meaning malignant neoplasms derived from smooth muscle cells, and angiosarcoma, for example, referring to malignant neoplasms arising from blood vessels. Also derived from mesenchymal cells are blood-forming cells, and we use some separate terms in this instance. Leukemia, referring to blood-forming cells originating in the bone marrow, and lymphoma, referring to malignant neoplasms arising from lymphocytes. We use the term carcinoma to refer to a malignant tumor of epithelial cell origin that is derived from ectoderm, mesoderm, or endoderm. This may be further qualified according to the type of epithelium from which the tumor is derived, such as squamous cell carcinoma, referring to malignant neoplasms arising from native or metaplastic squamous epithelium, or adenocarcinoma, referring to tumors growing in a glandular pattern. We may also qualify it by referring to the tissue or organ of origin, such as renal cell carcinoma. In addition, there are some what I call inappropriate but beloved nomenclature of tumors, and these include benign sounding names of malignant neoplasms that, despite the fact that we just add the suffix -oma, instead of sarcoma or carcinoma, but these nevertheless refer to malignant neoplasms. And examples are lymphoma, which I talked about before, melanoma, which are malignant neoplasms derived from melanocytes in the skin, mesothelioma, which refers to malignant neoplasm derived from mesothelial cells lining internal body cavities, and finally seminoma, which refers to a malignant neoplasm derived from germ cells of the testis. So watch out for these curveballs. There's another category of mixed tumors that also has a peculiar nomenclature. Mixed tumors result from divergent differentiation from a single neoplastic clone. An example is a salivary gland tumor called a pleomorphic adenoma, which is composed of epithelial and mesenchymal elements in varying proportions. Teratoma refers to tumors that are composed of a disorganized jumble of mature and or immature cells that are derived from more than one germ cell layer. The explanation is that these originate from totipotential cells that are present in the ovary or testis, or rarely from abnormal embryonic rests that may arise in the midline of the abdomen. And finally, there's a few other terms that you should be aware of. Hamartoma, which is a benign but disorganized tumor composed of cells that are native to the involved site. And choristoma, which is a nodule of mature, well-differentiated, and normally organized tissue that just happens to be found in an abnormal or ectopic location. Another term for these are heterotopia, meaning different location, literally from the Greek. So that is an overview of the nomenclature of neoplasia, and should give you a working vocabulary as we go on and learn about some of the general characteristics of neoplasia and specific tumors in this case.